I'm a 2-year survivor of mucoepidermoid carcinoma, which in simpler terms is cancer of the salivary glands. And back in spring of 2019, we were on vacation, and we were in Mexico, and so I was, trying out different foods, and had something for lunch one day that just left an awful taste in my mouth. And so get back to the room, and I'm literally like brushing my tongue, trying to get this awful flavor out of my mouth, and I saw back in the back of my mouth sort of a lump on my tongue. It wasn't painful. It wasn't an odd color. I really didn't think too much of it, and like I said, it was pretty far back on my tongue, and I thought, well, maybe that's what the back of your tongue looks like. Um, Fortunately, the week after we got back from vacation, it was time for my 6-month dental checkup. And so, because it was sort of fresh in my mind, I asked the dentist to take a look. Um, he was sort of with me. He's like, I don't think it's anything suspicious, but why don't we send you for a biopsy just to make sure? So went within a week and had a biopsy. The oral surgeon called me a few weeks later and said, we're sorry to tell you, but it's malignant. And of course, that's a huge shock. And he and I talked for about 15 minutes. And about an hour later, I had to call him back because I didn't remember anything he'd said other than, you have cancer. So from there, it was sort of a pretty quick whirlwind. Got in within a week or two to the oncology team. The oncology team told me that the surgery to tackle what I had was done robotically, and basically that they had access to the robot either the next week or 2 months from now. So within a week, I had a whirlwind of tests and went in for the surgery. I very naively thought that the surgery was going to be sort of like the biopsy was, which was an outpatient procedure, and I ate soft foods that night and felt normal the next day. That was not the case. I was in ICU for over a week and in the hospital where I about that long again, because I couldn't go home until I was able to swallow, and the surgery kept me from doing that for about a week and a half. But luckily for me, they got all of the malignant area during the surgery. I didn't have to have radiation or chemotherapy. And I really think that it's because we caught it very early.